Hello, we are at Bridgeton obviously today, and I am going to get to go behind the scenes at the Access Center. So we have thousands of patients that are scheduled every single day, but I actually have never seen how that process works. And most importantly, how much work it takes to actually just schedule one person. So come on in with me.
Thank you for calling Inspira. This is Dion. How may I help you?
Thank you for calling Inspira. This is Brianna. How may I help you?
So here we are in the middle of the Access Center. I'm trying to be quiet. At the same time, though, I'm so excited. Thank you guys so much for giving me the chance to be here today and really show our patients, as well as our staff, sort of what happens behind the scenes. Just talk me through sort of your day on how you would normally work with somebody who calls in.
So when they call in, it's just like I'm working there. They're a patient calling in, and I find out what they need, try to handle what they need efficiently. We have everything up. We know everything about the doctors, what they do, and how to schedule. If it's something I can do, like schedule an appointment, something like that, I can handle it. But if they're sick or something's going on, they need a refill, I can transfer them over to one of the nurses.
Then I take them through and I ask them how their day is going and what I can help them with. And usually they'll say either I need a medication refill or I'm not feeling so well. And then we just calm them down, assure them we are here for them. And they'll say, I know you're busy. And I'm like, no, you're the only patient I have today. And I give them all the time in the world because lots of times we are the only connection for some of these people.
Well, great. Well, take me through it. Let me see how it actually works.
Good morning. Thank you for calling Inspira. This is Dawn. How may I help you?
Hi Dawn, I am calling to see if I can schedule an appointment with my provider.
Let's verify your name, date of birth, address, and your current insurance.
Okay, my name is Shelby Harris.
I can get you in with Dr. Bober next Thursday at 3 p.m. in the Mantua Primary Care. Was there anything else I could do for you today?
Actually, I do need a refill on my metformin for my diabetes. Is that something that you can help me with?
I'm going to transfer you to one of our nurses who will collect some more information from you and assist you in getting that refill in.
All right, so now Shannon will come in and show me how to take through the med refill.
Yes,
Okay,
absolutely.
great.
Hi Shelby, my name is Shannon. I'm one of the nurses that works with Inspira Medical Group. How are you today?
I'm well, how are you?
Great. Dawn told me that she scheduled an appointment for you for next Thursday at 3 p.m. with Dr. Bober. You wanted to get a med refill today. Could I find out from you what the medication is, the name and the dose, so we can verify that I have that in the system for you?
I need a refill on my metformin. I am out after today. My sugars have been occasionally fluctuating. Nothing too low, nothing too high, but I would like to talk to my doctor about it.
So we can order that for you right away. And as long as he approves it, that it will be sent right to the pharmacy. And I will also make note that when you come in next Thursday at 3 o'clock, that you would like to talk to Dr. Bober about your blood sugars fluctuating. Is there anything else while I have you on the phone that I could help you with today?
No, I think that's it. Thank you so much.
Thank you for doing this with me today. It just was so wonderful to be able to see all this.
And it's a great job. I love my job. And we can give that patient the undivided attention that they need.
It's just amazing to me as I think about less than, what was it, a year and a half ago, right? A year and a half ago, we had each of these at, all these schedules at different offices. Nothing was coordinated or tied together. And now you could see all of it, like right there, both for you guys to be able to, offer the patients options, but then you get to see all the clinical information to literally, as you said, have that opportunity to work with that patient, right there as your only patient.
Up to 25% of calls would get unanswered, and now we can get the calls answered. The people at the front desk can focus on the patient just checking in right in front of them without the calls ringing off the hook, and we've got that number down to about 7 to 10% of calls, and it's just been, a great experience for patients who couldn't get through to the office. We're able to talk to them, get them scheduled, get them in, get Shannon and the team to do their med refills. It's amazing.
And clinically, I think it really helps the patients to get that right care at the right time, right where they need to be, utilizing tools like Clear Triage. Shannon can use her nursing judgment to get the patient the information and the education, and then get them to that right center of care so that we avoid those patients going to the emergency room that don't need to, get them those same day appointments, and get that information back to the clinician so they can focus on the patients in the office and we can focus on the patients that are calling from home.
I mean, that's probably the most important thing, right?
Yes.
For all of us.
Absolutely.
That we all have each other's back and that we have their back.
Yes.
I'm just so grateful to the entire team, and I just want to reassure everyone that our focus is making sure that patients get the access they need, our providers have less stress in reference to how much time they have on the computers, and again, just trying to make the whole process seamless. Thank you all for your time. Until we meet again, be well and stay safe.